detailed, precise, but easy to follow. He's got a beautiful PowerPoint ready tonight. This will be recorded, and so you'll be able to go back and listen to it, and you'll need to, because he's going to pack a lot of information in a short period of time. I don't know that I would take notes because don't you think, Tina, the PowerPoints have all the information on them, and when you go back and look at it, the PowerPoint, then you can make pictures of that. And then I'm going to be posting some things afterwards. And yeah, I actually could post the entire PowerPoint with his permission.
If you're on your phone or iPad, you can just take screenshots.
Yeah.
You can have it as notes if you need to, and just sit back and just soak it in. And if you do need to take notes, just take the recording and take notes then.
Okay, let me, I'm not going to do a lot of overview tonight, but I like to do a little overview. This organ is different than some other organs that we have talked about in the past. I'm certain everyone knows where your thyroid is. It views around your trachea, is shaped like a butterfly, and it goes down and around, and your trachea is open to the skin, and your thyroid attaches right to the side. It's a tiny organ. It's a tiny organ. The average thyroid is like 7/10 of an ounce, or up to a whole ounce. So it's little bitty. Having a thyroidectomy is not going to help you lose weight. It's an ounce. But it was given a lot of jobs when it was developed, and it's controlled by the pituitary gland, and then the pituitary gland, which is in the brain, and then the pituitary gland gets its information from the hypothalamus. So we're starting with the hypothalamus. Messages are sent to the pituitary. The pituitary signals it down for hormone release from the thyroid. No wonder there's lots of reasons that you can have problems with your thyroid. It's just a part of the chain, and there's a lot of, the more parts you have, the more areas that there could be a situation in. So sometimes when people say my thyroid, and I have thyroid, and I have this, or thyroid this, may not even be thyroid. It may be pituitary. It could be parathyroid. But just so that you know, that is not a self-sustaining, independent little 1 ounce organ. It receives lots of messages and lots of stimulants, and it's kind of like some of us, it's told what to do sometimes. The thyroid's kind of told what to do. It's the only organ in the body that has anything at all to do with iodine. It's called the iodine trapper, and the iodine that it traps mainly comes from, here we go, your diet. And as we've learned, every week, every system, every organ, every cell in your body circles back to diet, and hence does the thyroid. Dietary sources are the main sources, and just fun fact, when ionized salt became such a bad thing for people's blood pressures, and first one thing then another, and everybody cut back on their salt intake, there was a huge increase in thyroid conditions. So number one, we do need salt. We do need iodine, and our diet is where we're gonna get our iodine. Even though it's tiny, like I said, it holds enough in that little 1 ounce or less than 1 ounce organ. It holds enough hormone that if it was to be spontaneously released, it could kill you. It could kill you. So it has to be monitored very, very carefully. The pituitary and the hypothalamus got a big job overseeing this little tiny thyroid, because this little tiny thyroid is full of hormones that, like I said, if they were released, would absolutely cause a condition known as thyroid toxicosis, and it's deadly. It's deadly. So here again, in our beautiful body and our beautiful system, we have some very intricate details that we need to understand and know about. Thyroids can be elevated. Thyroid levels, hormone levels can be elevated, or could be diminished. And Dr. Mark's going to differentiate those, I'm certain, between the hypo and the hyper. The symptoms are different with the conditions, and it's probably one of the most overlooked diagnosis in history. It's easy to overlook it. Physicians don't all understand what they're looking for, and they just got a little knee-jerk test that they do with certain blood levels, and they're like, oh no, you're fine. Your thyroid's fine. I have actually talked to people that have had symptoms. They didn't know a whole lot about thyroid, but everything they read leaned them in that direction, and doctor after doctor told them, it's not your thyroid. Come to find out, they were never having the appropriate testing done. And yes, it was their thyroid. Of course, the big thyroid issue is people with thyroid that doesn't function well and they have weight gain. I wanted that to be my issue for years. I did. I just said, it's my thyroid. It is my thyroid. I'm fat because my thyroid doesn't work well. The real truth was, it was that my hand worked too well. Had nothing to do with my thyroid. But that would have been a simple fix. I kept putting things in, and that was the weight problem. Everybody that gains weight thinks it's their thyroid. It's not always. It's not always. But like I said, it affects men. I mean, women 5 to 6 times more frequently than it does men, as every bad thing. I mean, they just get off scot-free, essentially. It's just a woman's thing. I mean, it's just a woman condition, and it's tied into many, many other systems in our body. That being said, I'm going to let Dr. Mark come on, and he's got a couple of slides that's going to tell you a little bit more about him than I have done, obviously. But this is how tonight is going to be handled. He has a full slide presentation, PowerPoint presentation. There have been some questions sent in, as I ask. You got a question, you have to send it to me, and I forward it to him. He is going to choose 5 or 6 of those questions, and he will answer them. We will not be having an answer session, okay? It's not possible. It is absolutely not possible. The thyroid is very personal. It's different with every person. Nobody in this group wants to hear all your symptoms. I'm sorry. We don't want to hear how long you've had it. I don't want to hear how fat you are or any of those kinds of things. If you don't hear what you want to hear here tonight, he has agreed to do some consultations. He does have that as a part of his business, and we'll set those up for you. If you would like to personally speak with him for 30 minutes, then he's going to give our group a very good price for a consultation. But you need to know what you need to know before you get somebody on the line that can answer your question. You know what I'm saying? We don't need to be rambling around here with a whole bunch of insignificant things. So if you don't hear what you're looking for tonight, we're going to kind of do a little setup, and he's going to tell me how he wants to handle that. Invalid meeting. I'm going to facilitate it for him. All right. He has a very full-time business in practice, and you know, if you're easy, you don't need to pay him and spend time with him. A lot of questions will be answered here tonight. So there will not be our typical, do you have a question? We're going to unmute you and let you talk kind of session tonight. Pay close attention. Know that it's being recorded. Know that I will have a electronic copy of every slide that's being presented, so you can go back and study. He does not have a problem. These are compliant, Young Living compliant slides, PowerPoints, and he won't have a problem with you sharing those. There are some essential oils that across the board are very good for your thyroid, okay? There's about 3 or 4 that you can use whether you're hypo or you're hyper, all right? I do know what they are, but brain power, clarity, Endoflex. Whether you're hypo or hyper, Endoflex is a great thyroid oil. He's going to also, he has a slide with some others that he's going to talk to you about. Do not go to thyroid, and even with Young Living, and just say what oils are good for thyroid, okay? Because there's a group that's good for hyper or hypo, but then there are specific oils and blends and nutrients that are one or the other. So for gosh sakes, let's don't get messed up. Let's don't get messed up and not use the correct ones, because there's a big difference in being hypothyroidism and hyperthyroidism. So be very, very careful. He's going to give you a nice slide tonight and help you with that. But I'm assuming he's on here, Tina.
Hey,
okay.
Jenny.
Hey, Dr. Mark. I've introduced you a little bit. I know you've got some great slides. I have explained that we're not going to take lots of questions, and that some people have already emailed me, and I think I sent a couple of questions to you. Other people will be emailing me afterwards. You don't even know what you've gotten into when you do one of these Zoom calls. It seems to be lasts for years, okay? It seems
I've done more Zoom calls in the past 3 months than I'll ever do in my life, I think.
I know. I tell you what, Tom Gonery did a Zoom call for me about joint and health pain, and it was like 3 or 4 weeks ago, and people are still asking him questions. Kenzie Lovinggood, of course, did the gut for us. She's like, could you tell people to just shut up? You know, I'm going to try to protect you from some of that, and I promise you that I'll do the best that I can. So y'all pay close attention, and let's give Dr. Mark the time that he needs tonight, okay?
Well, thanks, ladies and gentlemen. I appreciate Janie asking me to come on and speak to you. So how many people, raise hands, were at the retreat October 2018? There's a few there. Yep, there's a few there. Well, hopefully this won't be too boring for you then. We'll go back through this. What we're going to try to do is lay some foundational work for thyroid. And I am going to open up a share screen here. Let's be sure it comes up. All right. Can everybody hear me okay?
Yes.
Volume's good?
Yes.
Okay. So probably for everybody's benefit, if you're not muted, Janie, you probably ought to stay on, and maybe Tina, if you're not muted, you probably should do that. So we can do this. So let's talk about thyroid. We'll try to get as much in as we can. It's not an easy subject, but yet when you step back after listening, I think you're going to see that it's easier than you think it is. Thyroid, of course, is always a, if I can get my screen to advance. Bear with me just a minute. Tina, I'm having a little trouble getting advancement.
Ask Tina or Sheila, not me.
Okay. So let's try it again here, see if I can get it to occur.
It should be, if you're in PowerPoint, it should be just like regular way.
Well, it should be, shouldn't it?
Yeah.
I'll tell you what. Let me go back one time. Start here, and I'll start the process.
Yeah.
Here we go.
There you go.
Okay, so got to have this disclaimer in there. So we're not trying to diagnose or to treat or to prevent any disease. All these products we're going to talk about eventually are not intended for those purposes. But even though this information is not reviewed by the FDA, this is common knowledge. It's stuff that your practitioners, your PAs, your NPs, your doctors deal with every day. And I can't emphasize enough that each individual practitioner has their own pet list of tests that they run for thyroid. It may only be one value. It may be 5 or 6, but the normal process is there's usually about 2 or 3. So just to kind of let you know what I do, a little bit about my practice. I've been in community pharmacy now for 44 years. We opened this pharmacy in 1982. Currently, we're in the medical center part of Nashville. Our primary business is compounding medications, and we do that for patients. We do it for research. We do it for veterinary pharmacy, private patients. We do it for surgical centers. And then I've always had a real knack for wanting to stay in touch with patients. So I do a lot of laboratory testing. We test for hormones, thyroid. We do testing for autoimmune disorders, nutritional deficiencies. And that's very helpful when you're trying to help patients get better. I mean, truly get better instead of just putting another drug onto their regimen or something else to help control symptoms. We have several collaborative practice agreements that we have in place with local practitioners, and that enables us now, if you're willing to see that practitioner, then you can come to our pharmacy. We can start doing laboratory values on you from here. We can actually start you on a therapy, and then eventually you'll see that practitioner. And that type of collaborative practice is growing around the country. So if you don't, just because we have it here, don't think it's not where you live, because it probably is. Someone there, some compounding pharmacy will probably be involved in that. And we do a lot of sterile compounding. Of course, if you're not familiar with the term compounding, basically we make just about everything that we dispense. And sterile compounding is a specialty because it takes a lot of effort. It takes a lot of regulatory issues. And it is a great way to meet patient needs. So here are some of the different clinical services that I offer to patients. You'll notice the one at the bottom of that list there is recent. We're going to have the ability to tell you if you have COVID-19 antibodies. Everybody's going to want to know that for too long. And these are some of the topics we talk about day by day. We are an accredited pharmacy. Less than 1% of all the pharmacies in the United States are accredited. And we are accredited for sterile and non-sterile compounding, which means that all the pharmacists and technicians must each qualify. They have to turn in products that we make for patients, and they have to be tested. We have unannounced surveys. We do a quality patient care analysis that gets updated day by day as we practice. So what we're going to try to talk about and learn today is symptoms. What constitutes a complete thyroid blood panel? What other organs contribute to thyroid function? What nutrients and supplements are important to maintain thyroid function? And of course, what oils will assist you with this process if you're an essential oil user? Even if you're not, there's some excellent opportunities here with these oils. So here's a basic premise that I talk to patients about all the time. It's very simple. It doesn't really matter if you're 20 or 50 or 85. This principle of health is going to hold. So our bodies require a daily input of nutrients. most of those, as you know, come from food. And as these nutrients begin to diminish, replacement is required if we're going to maintain proper body function. So you put the right nutrients in, you're going to get good function. If you don't put those nutrients in, you're faced with more disease and more organ failure. Now, why is it so hard for physicians and other medical personnel to understand why we study nutrition and why we put emphasis on nutrients, supplements, and they're talking about medicine? I'm probably one of the most non-drug pharmacists that you'll ever meet. And it's important for us to understand that pharmaceuticals have a place. So these endocrine systems, endo meaning internal, are systems that have glands in the body, and they're all present, but they're more important, they're all involved in proper thyroid function. And when I say function, it's because thyroid's not just about having it made. There's a second part to that people seldom pay much attention to, and it's called thyroid uptake. So you may go to the doctor and you may feel, after looking at this, that some of your symptoms are thyroid. And you may also decide with the doctor will say, well, your thyroid labs look really good. I know some of you out there have heard that before, but the problem is twofold. You have to make the thyroid, you have to make the hormone, then it has to be absorbed properly and put into the cellular space. And that second part is really an important function. We're going to talk about that. So the interplay of all these hormones is essential to good health. One system is adversely affected, then the imbalance of the entire organism is disrupted. And I ask patients that think of it like a symphony. It's a symphony of hormones. If you've been to the symphony before, there's a bass or a wind section, there is a percussion section, we got strings, we got horns, and the conductor's up there, and he can tell if somebody's playing off tune or playing the wrong notes. And that's exactly what this is like with your body. Each hormone is playing a part. It's setting up a rhythm with the rest of this orchestra, and that is your body. So there are a lot of players here, but they're all critical. And again, if proper nutrients aren't there to supply the hormones, then we're not going to see the same function. So question comes about too little or too much. Am I hypothyroid or hyperthyroid? These are not the only reasons, but these are common reasons why you might be hypo or underactive. Gland failure. We don't really know what causes that. At least we don't have all the answers on it. Genetics, poor nutrition, surgical reasons such as you had a nodule and they had to take part of the thyroid, or in some cases all the thyroid, or they decided you had a tumor in the thyroid gland and the best thing to do is to give yourself some radioactive iodine, kill the thyroid. You can also have poor thyroid function from what we call estrogen dominance. And estrogen dominance is a whole new topic, but basically we see probably 40 to 50% of American females between the ages of, say, 45 to 55, they become more dominant in estrogen. As a result of that, they suppress the normal function of the thyroid. And so it's common for us to see changes in metabolism at or near perimenopause and menopause because of these changes in thyroid activity. We also have autoimmune conditions. Probably the most common we see is Hashimoto's thyroiditis, also known as autoimmune thyroiditis. There are other conditions that can go with that. We also have a lot of contaminants. You know, we know about that, I'm sure, from previous presentations you've seen about environmental contaminants, chemicals that we use around our home, mold or mycotoxins, that's the gases that molds give off. You know, we know that these things affect our body's hormone levels and affect different organ systems. The thyroid is very, very sensitive. Heavy metals, toxicity, you know, from previous exposure to lead or other types of contaminants like that. Mercury is one of the ones we see probably the most, that, you know, a lot of us who are, say, 50 and older typically have mercury type fillings in our mouth. And some of that mercury can leach out, can affect our thyroid. And then, as Janie mentioned a few minutes ago, you know, a lot of us changed our salt usage in the past. And not only that, but we started using a different type of salt. And refined salts are they're a little bit different than natural salts because they use chemicals to wash the salts, to clean it up, bleach it out, you know, make it pour out of a salt shaker real good. The problem is some of those things they use have an affinity for receptors that are on our thyroid gland. So it blocks the iodines from getting on there like they should. So hopefully you'll see that there's a lot of different detail, a lot of different things that impact the thyroid and affect this. So hyperthyroidism, which we don't see as often, but it happens. Genetics, poor nutrition, autoimmune conditions, as we mentioned. Wilson syndrome is another. But people that have hyperthyroid have a hard time just standing still. You know, they're all the time moving. They're agitated. They've got a lot of anxiety. Sometimes the hyperthyroid condition doesn't start until later in life, and that particular person starts losing weight. And they're just basically burning it off. It's just about as quick as they can keep it on. But hyperthyroidism usually is based more in autoimmune conditions. It takes a little more to get that under control. Sometimes some pharmaceuticals have to be used to slow it down or stop it until we can get it under control. The most common by far is hypo or underactive thyroid. And we see this in as much as 40% of the population. And then when you look at this next slide, which I think it's next, nope, it's the next one down, but we're talking about all the different symptoms. We're going to find out that with that huge number, 40% of our population could be impacted with underactive thyroid. You're going to scratch your head and say, well, no wonder there's a lot of use of antidepressants, and no wonder we have all these other problems. So you think about thyroid, I want you to think like Janie was talking about what we call the thyroid cascade. I want to start at the pituitary because this is where we really see this. We commonly see doctors run a TSH level, and that thyroid stimulating hormone is not a thyroid hormone, it's a pituitary hormone. But it's what kicks the thyroid gland, and it stimulates that to release the first two, T4 and T3, the first two thyroid hormones. Then you go through a conversion process. Everything converts down to one active thyroid molecule, and it's called free T3 or liothyronine. And I only find that about 1 out of 10 doctors measure free T3. So they're measuring the top numbers, they're not measuring the bottom numbers. And unless we're really looking at the bottom numbers, then we can't see the full picture. The second line from the bottom there says reverse liothyronine or reverse T3. It's a totally inactive form, and some patients have very high levels of reverse T3 due to excessive stress. And as a result of that, they have very little free T3, which is the active metabolic molecule. So, yep, it gets a little complicated there. So pay attention to that free T3 molecule, because that is the go-getter. That's the one that does the job. And here's the slide I was referring to. So look at all these symptoms. I'm not going to go through all of them, but they relate to dermatology, internal bowel obstruction, elevated cholesterol, on and on and on. There's a lot of different symptoms here that thyroid is active in. And you say, well, I've got poor memory. Well, you may. It may be due to another reason too. But some of these, if you have a combination of these, that's when we start to pay more attention to what we really think might be involved with your thyroid. So thyroid is the primary hormone responsible for the rate of metabolism. That doesn't seem to be much of a problem for any of us up till age 25, 30. Then we get stressors that hit us through life. We get kids, we get jobs, we have spouses, we have financial concerns, and our stress level goes up. The normal range for thyroid hormone is very broad when you look at it from the common test of TSH. The optimal level is much more narrow, and it's very highly desired, because if we can put you into an optimal level metabolically, we can eliminate most of those symptoms that were on that previous slide. So without adequate thyroid hormone activity, the production of energy in each and every cell of the body is compromised. Inside of each cell, we have these little guys called mitochondria. And mitochondria produce adenosine triphosphate, or ATP. That's our energy fuel for the cell. That's what it uses to burn and create energy within the cell for the genes to use. So all the cells in our body, skin cells, brain cells, everything uses thyroid hormone to regulate metabolism. It's no wonder we have such a trouble with this. So here's something I really recommend that you do. It's probably easiest symptomatic test we can do. And you'll have to have a digital thermometer, which by now with COVID, most of us probably have that. Put it right by your bedside. When your alarm goes off, turn off your alarm, turn on the thermometer. Don't flare the covers back, stay under the covers, lie still, and wait for that reading to come. Now, record your temperature. Do this for 5 or 6 days in a row. You're going to find a lot of you will be down to 96 range, 96.5. That is poor core body temperature. If we're not pushing temperatures close to 97.5 or higher, then very good chance that regardless of what the doctor says on your lab sheet, you got a thyroid issue. It's just not performing, either not being produced or not being taken up, one of the two, not performing properly. Iodine deficiency. This turns out to be a really big deal, because we used to talk about the concept of salt being bad for blood pressure, causing you to retain fluid, but it's led to these iodine deficiencies because we used to have salt that was iodized, and we still do. And iodine is necessary for this conversion process to convert thyroid hormone from T4 to T3, which leads us down to the free T3 molecule again, which is the one that really works. And if you take a refined table salt, we talked about this a moment ago, bromides, which are compounds used to wash that salt, can block receptors of iodine. And as a result of this, iodine deficiencies can result, especially in, manifest itself as a goiter or the swelling of the thyroid gland. This iodine plays another very critical role throughout the rest of the body. It's this process we call apoptosis. Every cell in your body has a program, just like the one in your computer. And it basically says you're going to divide, you're going to produce your function of that cell for a period of time, and you're programmed to die at a certain point to be replaced by another cell. That is normal cellular apoptosis or cell death. But when we have insufficient iodine, we have a tendency to delay this process, and instead of the proper apoptosis, we have this unwanted increase in cellular growth, which could show itself as cysts, nodules. You know, I can equate it to some endometriosis, also to uterine fibroid tumors, some other women's health issues, especially breast cysts, where you go for your mammogram and they say you've got a fluid body here that needs to be checked out. We commonly give iodine and another common hormone to our ladies that have this problem, and it just sort of goes away. The Japanese people ingest a great deal of iodine in their diet, or at least it's considered to be a great deal, but they ingest about 15 milligrams per day, and they have the lowest incidence of breast cancer in the world. So don't get too worried about iodine, but this is be on your checklist of things to ask your doctor for. Unrefined salts. These are the salts that I would recommend that you use in your cooking, in your seasoning, either Celtic, Himalayan. There are some others, but I want you to look for salt that it's irregular in shape, that it has some color variation to it, anything other than small white crystals that come out of a salt shaker. You know, that's not to say that you wouldn't salt something if you were in a restaurant, but when you have the chance to use good salts, you want to use those because they also promote proper mineral balance. There's a certain amount of magnesium in natural salt. Iodine must be replaced by supplementation, and somewhere between 10 and 15 milligrams is a very reasonable dose per day. Again, have your level checked. Here's that note I had earlier about fibrocystic breast nodules and breast density. It can be reduced and improved by the use of iodine. We've done that so many times. So here's what I recommend. This will be on the PowerPoint for you guys to take, make a list of these. These are the tests that you really need to look at. And your doctor's going to say, well, why do we need all these tests? Well, if you want to see how the performance of the gland is, this is what you do. Typically, TSH, maybe free T4 is about all we see done. But you also need total T4, total T3, free T3, reverse T3, ferritin, thyroid peroxidase antibodies, or TPO, an iodine level, thyroglobulin antibodies, and I like to also get a vitamin D level called 25-hydroxy vitamin D. Mm-hmm. You're going to have a lot of information there because everything we're talking about, ferritin as a protein is made by excess iron in your body, and the iron turns into ferritin, and you get better thyroid distribution through your cells. The 25-hydroxy vitamin D level, you may not know that, but vitamin D is really a hormone, not a vitamin. It actually does signaling in the body and sends messages to improve tissue building. So you can walk into a cash lab, be pretty expensive to get this profile done, but you can also get it through insurance if your doctor says you need a full thyroid panel. If you have to do just the minimum test, do the TSH, free T4, free T3. And if you've ever had, or they might think you have, an autoimmune condition, you know, some of those conditions take somewhere between 5 to 10 years to really fully develop. You've got to get this TPO because that can make a huge difference, not only in your thyroid function, but that's going to tell, it's going to tell me, and hopefully it'll tell your practitioner that you have a gastrointestinal problem. You know, you got a real gut problem that has to be healed. And hopefully your speaker that talked to you about that a few weeks back covered that as well. Okay, this is really important, and I'll want you to pay attention here carefully, because the thyroid and the adrenal glands are very closely in tune with each other. You know, you think about the body and how it operates. We have two adrenal glands, one on the top of each kidney. We have two lobes of our thyroid because it's a critical gland, just like the adrenals. And we have either two ovaries or two testicles. You know, these are important functional glands for us, and the body wants to give us a backup. If you have poor adrenal health, you're going to have poor thyroid function. And it's so important that if you have both of these together, you can't just fix it with thyroid. You have to fix the adrenal first. You've got to go in there and understand what caused the stressors, what were they, how they impacted you, and you have to start to work on the adrenal health problem first before you can start to work on the thyroid function. Now, most patients know their bodies pretty well, especially this group, because you're into listening about health and oils and you want things to function well. So best thing I can tell you to do is to empower yourself with knowledge. This book I put on this particular screen is really good. It's Dr. James Wilson. It's available on Amazon for, well, probably $10 to $15 now. But it's called Adrenal Fatigue, the 21st Century Stress Syndrome. And if your adrenal glands do not produce enough cortisol for you on a daily basis, you will not get thyroid hormone from your bloodstream into your cells. It's just that simple. So that has to be addressed when patients come and say, I'm tired, you know, and I've got brittle nails and I've got hair that's falling out and I got all these other issues. We always look at thyroid hormone. We always look at adrenal function because they're linked together. So adding thyroid hormone to a patient that has a very weak adrenal function will result in an exacerbation of thyroid deficiency symptoms. You will get worse. You cannot handle the load of more thyroid hormone if your adrenals aren't working properly. So normal adrenal cortisol release gives you ideal thyroid uptake. That word is really important, uptake. Elevated cortisol release, because of too much stress in the initial phase of this, results in thyroid hormone inefficiency because it's blocked at the receptor by the excess amount of cortisol. So guess what? You can have problems with too much as well as too little. And this is true of every hormone. Too much or too little typically results in poor response. There is a sweet spot for just about every hormone that we're going to talk about. If you have a suppressed cortisol release, which is what happens when people get worn down and they're pushing through everything and they're not sleeping at night, they wake up tired and they feel like they've been run over by a Mack truck just about all day long, then you're not making enough cortisol. You're not activating your thyroid hormone. So how can stress cause so much illness? So you go through these different stages. You have this arousal phase. You get this rapid increase in these chemicals in the body, these alarm molecules. You get a slower increase of corticosteroids, which are stress steroids. And that's the first phase of adrenal stress, which, you know, you have a car accident, you have a fender bender. It's not too bad, but hey, it causes this rapid increase of these chemicals. Your body compensates for it. But also you've got 3 meetings to make this week, and you got the kids and you got your husband and he's drinking or something, and you know, you're trying to adapt to this. So that's what your body does. You characterized by sustained increased levels of these alarm molecules. And the longer you stay in this situation and try to push through everything, the more of a problem it becomes for your body. you have an altered glucose tolerance, your blood pressure, thyroid hormones, sex hormones start to change. And then you hit this phase, exhaustion. You wake up tired, as I said earlier. You're not feeling like you even start your day at all. But then maybe some of you feel better between, say, 5 p.m. and 8 p.m. at night, because there's a little bit more cortisol being released at that time. And then you try to sleep at night, and either you can't go to sleep, or you go to sleep and you wake up 2 or 3 hours later. You know, you got adrenal problems. You got to get that fixed, and learning how to. So back at that slide where we talked about Dr. Wilson's book, it's the best roadmap I can give you, other than doing it ourselves. It's just important that you understand the process and how it impacts your health. Here's a great stress reduction kit. So you lay this on a firm surface and you follow the directions on the kit. Got to have a little humor. Bang your head there. So, who is at risk emotionally and stressfully? You look at this list to the left. I see it happening in adolescents. I see it in grad students. I see it in young moms. I see it in perimenopausal hormone imbalance women. I see it in postmenopausal women who are trying to sell oils. I mean, really, you just have to start paying a lot of attention to what your stress levels are and trying to control this, because this will impact your thyroid function. So what is stress? How severe is it? Right now we have this. We have pandemic stressors. You know, we're at home. We're trying to do this on a Zoom meeting. We got kids, you know, barking at our feet, or we have illness to deal with. We have, you know, jobs that have disappeared, financial, future retirement. Yeah, a lot of concerns about our country. You know, what can we look for back at the pandemic of 1918 to 1920? I got to tell you a little story here real quick, because it never really hit me. My dad came from a family of 19 kids.
Oh.
And there were her kids and his kids, and they lost their spouses, and they married, and then they had another family of 4, which he was part of that. And then they adopted 4 kids from down the road. And he always said, well, the mom and dad died from the grip. And I thought, okay. And I looked up grip and it said flu. But the year was 1918. And I never realized that that was actually during the pandemic of the 20th century. So, you know, this stuff has been with us for quite a while. And you think about all those stressors. People were coming out of World War I with all the deaths and the people that died in Europe. And then they got hit by this worldwide pandemic. So they had some stressors back then. And then we got stress-free. You know, so you got this plan. So that's not what most of us are ready for. We have this problem, financial stress. You know, how much it costs businesses and how much it costs each of us individually, you know, go see practitioners because, hey, we're not sleeping. Well, here's a prescription, go get it filled, you know, take care of your stressors. Stress is considered to be the culprit in 70 to 90% of the employee hospital visits.
Right.
And then orders for medications are written after that. So we really don't want to continue to do pills for Band-Aids. We want to look at the root cause of the problem. Very little is being done to protect our bodies from stress or to help them recover when stress causes damage to our tissues. And not only to our adrenal tissues, there is inflammation in the brain as a result of excessive stress. So the typical medical response is to write a prescription for antidepressants, sleeping pills, medications for anxiety, and we have to address this problem. We are the problem. You know, we've got to figure out a way to control ourselves and reduce our stress internally. So get an idea of what our adrenal gland there in the center is faced with, Mr. Adrenal, all these different types of stressors that we were impacted throughout the day, throughout the week. Some that we don't even know about in terms of pure water, quality foods, you know, what's in our air that we breathe, what kind of other toxins do we absorb as we live on this earth. So you look at some of the different responses upper in the upper left corner. When stress goes up, remember we said that when you're having thyroid issues, you can have an increased cholesterol, and that's part of why it goes up. You get this blood for energy production system going. You get an increased blood pressure, and we get medications for that. You get a localized redness and swelling and pain at the point of inflammation. You get increased production of blood sugar. You know, then we become pre-diabetic. So all these are stress factors. So, you know, if I had to say anything tonight to hopefully, you know, personally evaluate your own stress level and take steps to make the change. Because stressors are additive, they're cumulative. The more stressors we have, the greater intensity of each one, the longer they last. And, you know, stressors don't accumulate on a linear basis, they accumulate on a vertical basis. You know, you carry that stress load with you all the time. So here is our circadian clock. Now, I think it's important for us to kind of look at this and kind of picture ourselves, especially if we have some sleep issues we're working on. You start at the top at midnight, you get your deepest sleep around 2:30 a.m. The pictures on the screen block out some of the side on the right. I can't read them, but I know there's one that says that around 4 o'clock in the morning, you could possibly have some wakefulness going on there. I'm going to have to move down to where it says 8:30, I think, 8 or 8:30. You normally see your bowels become active. 10 a.m. is typically your period of highest alertness of the day. And then you move into noon, and beyond that, your better coordination is in the afternoon, your reaction times, your greatest cardiovascular efficiency and muscle strength. And then those continue to go up until around 9 p.m. when the sun goes down, the lights start dimming, and you start getting melatonin production, preparing your body for rest and for onset of sleep. So it's important to maintain this function. People that have adrenal issues and therefore thyroid issues, most of them are not on this pattern. You can think about that, kind of look at the pattern, see if it makes sense to you. So your adrenal glands are really necessary for life. They're the other organ that is also involved in energy production. They control carbohydrate, protein, and fat conversion. They are second only to the pancreas in managing blood glucose. They help for fluid electrolyte balance in the cells, interstitial fluid and bloodstream, fat storage, and they're also involved in, especially after menopause, sex hormone production. Before menopause, it's usually adrenal and stress response. I don't even know if we want to get into this slide or not. But this is how we make hormones. And if you look at the top yellow at the very top of this, you'll see it says cholesterol, LDL. And then below that, you see pregnenolone and progesterone. So this is all a cascade. The process works to control and produce the hormones that we make in our body. Cortisol is at the lower left, toward the green. It's one of the main functions of progesterone. And progesterone is produced at ovulation until you start having ovulatory cycles. And then from that point, you have to replace progesterone if you want good for cortisol production. There are oils that help your body do that. Also, we make in our adrenal glands, we make DHEA. and DHEA converts into testosterone. Helps to keep your muscles strong, helps to keep your brain functioning, your cardiovascular system protected. And then these ones in the red in the lower right-hand section, you know, they're the ones the doctors don't want to do anything about because they feel like it's estrogen and you're at risk. When in fact, you know, estrogen is very cardioprotective, it's very estrogen and breast protective. Your bones, your brain, it just takes proper amounts. So, talking about progesterone, because it's critical for adrenals, you've got to pay attention to this, especially if you're in a high stress situation. If you're taking an oral contraceptive, or if you're doing some other method of contraceptive other than condoms, because production of progesterone is really important. It prepares your body for stronger bones, stronger health, better thyroid function at or near or beyond menopause. High stress depletes progesterone and thereby severely reduces your cortisol production. And again, going back to thyroid, you have low cortisol production, you get low thyroid uptake. Okay, here's some pearls to help you remember about this. There's no substitute for natural progesterone. There are some prescription products that have natural progesterone in them. If you have any questions about whether you're getting it, you can email me. I'll be happy to give you my opinion on that. The hormone is either progesterone, the real thing, or it's a synthetic product called a progestin. A lot of doctors don't know the difference, but don't allow anyone to tell you that they are the same thing. Thyroid hormone function can be greatly affected by excess stress, estrogen dominance, progesterone deficiency, and all these symptoms of excess fatigue, dry skin, hair loss, and others can result from hormone imbalances. So your thyroid might be in good shape. If you don't have your other hormones in good shape either, then you might have some of the symptoms that are associated with thyroid deficiency. So progesterone production occurs at ovulation, and any contraceptive that inhibits ovulation sets you up for adrenal dysfunction. It's necessary throughout your life. If you're a hysterectomy patient and your ovaries have been taken, your body will always need progesterone to function normally, even if your doctor says you don't need it anymore, which we get a lot. Here's some resources for you. The website in green there, www.pccarx.com. If you go to the bottom of that homepage, there is a compounder locator, and you can plug in your zip code and tell it to look between 5 miles and 50 miles, and you'll find out if there's a compounding pharmacy that you can ask questions to and find out who are the best practitioners close to me that will help me with this. They will know because they see the prescriptions, they talk to the patients about this. I also use this company, ZRT Labs. They are great for saliva testing. They're the ones that are fixing to release the COVID tests that I mentioned earlier. You do not need a physician to get this test. You can call us and we can send you one, or you can call ZRT Labs and they'll send you one. You'll only pay what the best price is to pay. You won't pay any kind of upcharge going through me for doing that. Matter of fact, you just pay the lab straight. You just pay them. We don't get involved in that financial transaction. Also look for accredited pharmacies for the best in quality care. They're not always out there, but I'd look for them and I'd probably use them over someone who is not accredited. Here is an example test kit from ZRT Labs. As you can see, it says combo test. You can test saliva, and you can also do blood spot testing, and they will do some of these thyroid tests through blood spot. You have to use these little devices to prick your finger. Then you put a drop of blood on these little circles on that card to the right. and send it in, and they'll do TSH and free T3, free T4. They won't do some of the more detailed tests, but you can get an idea really quick whether or not your problems are related to thyroid or not. I really suggest if you do something like this, consider doing a full panel on it. It doesn't cost you that much more to complete that panel and get it all done at one time. You're going to see a different picture, and you're going to see that symphony we're looking for. So we talk about oils. Chemistry of oils is that they have the potential to affect all cells of the body. We know that. You know, healthy tissues can improve the function of organs, and organs then improve the function of organ systems that work together. So historical uses of oils suggest that there are many health benefits for the endocrine system. Some of the most important, I think, progesterone supporting essential oils, chaste tree berry and chaste tree leaf. Sometimes you'll find it both ways. Also, I like to see Vitex oil. Vitex has been used for many, many, many hundreds of years. The early Greeks and Romans used this for menstrual difficulties and cycle regulations. Even the monks and the nuns used this. It's pretty well recorded in history, 2,500 years ago. But it supports the body's production of progesterone and all the benefits that progesterone does for the female body. So other oils that I use typically when we say to support the thyroid, I want to have calming oils. I want to relax the adrenals. I want that stress reduction to take place. Janie mentioned Endoflex earlier, lemon, nutmeg, black spruce and peppermint. Those are all good to help calm you down. And then specific oils that support thyroid function, Endoflex again, clove, ledum, and then the Thyromin supplement, which Young Living makes as well. So there are other oils, combinations of, if you look at some of the texts that are out there and available, that things that are used as recipes to support, I'd suggest you try them. One of the best I found was one that was in, I call it the Magic Bible Book of Oils, but it's for the adrenals, and you do a hot towel compress using Endoflex and some other oils. It is great. You know, if you're dealing with weak adrenals, you can treat them topically right through the skin using that method. You may need some help with putting that compress on your back, but you want to be right above the waistline and putting those oils on first with the compress on top of it. More vacations, reduce your stress, practice saying no, because a lot of us say yes too many times. If you're going to support your thyroid, a lot of these changes happen during perimenopause and menopause. Myrtle is a very good essential oil in supporting this transition. It has adaptogenic activity. That's an interesting word. It means it's going to adjust to what your body needs. And you wonder, how does it do that? How can we possibly have a molecule like that that's intelligent, whereas pharmaceuticals, they are totally incapable of doing that. You know, they only have pre-programmed direction. They can do exactly what they're engineered to do, and that's it. But adaptogenic compounds, whether they're herbal or whether they're oils, they are non-toxic, they're beneficial, they improve the body's ability to resist the damage effects of stress, and then they promote normal physiological function. So there are a variety of herbs, of course, from which oils are derived, that are used as adaptogens in different supplements. I use a lot of these with patients. I find they're very effective. They're very calming, and patients comment about them quite frequently. So recommend you look at this category called adaptogenic herbs or compounds. when you're taking a all-natural approach to hormone, just say vitamin C and hormones. Hormones are nutrients, just like these other nutrients we've talked about. You've got to have good nutrients for good function. It's your choice whether you want to have a balanced thyroid, but it is different for every patient. It has to be analyzed. And if you go to your doctor and he says, well, we need to write you a prescription for a thyroid hormone, just remember that when he's doing this, this is a supplement. This is not a medication. You know, we would like for you to consider using desiccated thyroid products if you use those prescription products, but they are basically a supplement to help support what your glands are doing. Don't think of them so much as a medication, because that's what we're trying to do, is help you and help your thyroid function the best it can. Check your results. Most patients, once you start on a system like this, you're going to want to recheck levels in anywhere from 6 to 8 weeks. You're going to want to make tweaks to that, possibly. Maybe hit it right the first time, but in most cases, you have to do some adjustment and retest. So you'll go through initial testing, retest to check those, and possibly another time. And then once you kind of get on a pattern, you're probably good for at least a year. Okay. Well, thank you for your attention so far. Saliva test kits are available for thyroid, available for hormones. That is our website address right there, and below that is my personal email. If you have questions you want to send directly to me, or if you want to do some scheduling to talk something more in depth that you have questions about, Janie, I'll do whatever works for this group. You know I will.
Yeah, thank you, Mark. I know. Okay. You are just right on schedule here, huh, Tina?
Yep.
Yep.
Well, can we stop the recording now?
Yes.
Okay.